Welcome back. 8:30 right now on this Thursday. All this week, we are looking at cancer treatment and prevention ahead of tomorrow night's national broadcast called Stand Up to Cancer. It will air on Fox 5 at 8 o'clock. And today, we are looking at the post-cancer trauma that can affect survivors and their caregivers. Joining us now is clinical psychotherapist Cindy Crane with Crane Counseling to talk a little bit more about this. Good morning.
Good morning, Sarah.
You know, you don't realize how much of a trauma it really is. We think of traumas as in like car accidents and what happens after that, or war vets that have gone off to war and coming back.
Right.
But this is also a trauma as well, being diagnosed with cancer.
Having a diagnosis like cancer is like nothing else the majority of us can even imagine. And it brings with it a tremendous amount of anxiety, fear, worries, as you can imagine, and of course, trauma.
Okay, so what are some of the symptoms, that we should kind of be looking out for if it's something that's really bothering, an individual, the family, or the person that's been diagnosed with it?
Yeah, I feel like, first of all, triggers that come to mind immediately are just the initial diagnosis is traumatizing, particularly if it's an advanced kind of a cancer. And then the pain from the cancer itself, the tumor itself, for example, or the treatment, or even the side effects of the treatment. And then waiting for results is so scary, especially if you're waiting for the next scan or the next scan. And then, of course, the fear of recurrence or just waiting for the other shoe to drop, wondering when is it going to come back.
Right. And, I wanted to go a little bit more as well. Those are the triggers.
Yeah.
What are I guess, the symptoms you should sort of be on the lookout for of somebody that has PTSD? I mean, this is really kind of what we're talking about here.
Well, just to clarify, PTSD, post-traumatic stress disorder, is an anxiety disorder, but it has some sort of unique pieces to it. It is over extended period of time, typically within a month of exposure to some traumatic event, but it can also be delayed onset. So some of the symptoms we see of PTSD are nightmares and flashbacks, avoiding memory triggers like avoiding places or people who you associate with maybe the initial diagnosis. It sounds weird to think about it, but guilt and shame and certainly hopelessness, about how did I get this? What did I do? And then trouble sleeping and having trouble concentrating.
Mm-hmm. What's the best way to go about treatment? And people are, and I'm talking about on the mental side of things.
Right.
People are so focused on the treatment that they're undergoing for the illness itself that perhaps they don't think about what's going on around them and how that's affecting everybody else. How do you kind of make that next step when you're in the middle of just
It's
doctors
hard.
and prescriptions?
Yeah, right. When you're in it, it's almost like it's terrifying, but you have something to do. You have to show up for the next doctor's appointment. There's a plan, and you're in it. And people say, oh, you're so strong to be doing this. But I mean, what choice do we have sometimes? You have a lot of support around you. It's terrifying, but people are around to help you. They want to make you meals. They want to take you to treatments. And that in itself, trying to be on for people is difficult. Right? But then
you feel you have to be strong and you can't be showing.
You can't, yeah. Sometimes
emotion.
It's okay to just say, this is awful and I feel terrible, but people get scared for you. So that's a kind of difficult thing. And then the other difficult part is then after the treatment, okay, you're clear now, but it could come back, is this fear of what's next. So for a lot of people, there's a lot of trauma around just, what do I do with my life now? Sort of, do I like this job? Do I like this husband? Am I going to see my children grow up? Those sorts of things. It can be really hard. So to answer your question, I think it's really important to talk about it with a professional who can help you process and manage, and you can dump with that person and not feel that you're putting a burden on your loved one, but give you some concrete strategies and coping strategies to manage some of these sometimes overwhelming symptoms, because PTSD is numbing. It really makes you shut down. And some of the other symptoms I had thought to myself were, having fear and anxiety really heightened. So you're in this fight or flight sort of stance all the time. And then you also sometimes have, like I said about the numbing, decreased interest and pleasure in the things that you used to enjoy. So what can result from that sometimes is really self-destructive behavior. So you want to notice when people are isolating. Maybe they're drinking more or using drugs or some other kind of acting out behavior because they just feel like their world is out of control.
Right.
So if you see someone in your life who's also struggling in this way, even if it's a year or two after diagnosis, or certainly during treatment, is encourage them to talk to a professional.
Right. Cindy Crane with Crane Counseling, thanks so much for coming in. A very important issue as we talk about cancer and leading up to the telethon tomorrow. Thank you so much.
You're very welcome.
And again, here is the information on Stand Up to Cancer that is 8 p.m. on Fox 5 here tomorrow, Friday, September 5th. The number there on your screen for more information as well. And also the event Race for Every Child that is occurring Saturday, September 13th at Freedom Plaza. Opens at 7 a.m. and 5K run walk for that. Thanks again so much.
Thank you.
Steve and Allison, back to you.